Hey guys, it is Saturday, January the 23rd, 2021. It is post-COVID vaccine dose 2, day 15 for me. This is one of my little sidekicks here, Carson. Say hello, Carson.
Hey.
I'm doing great, no issues, feeling good, excited that I've had both doses of the vaccine and I'm doing great, and that my body can fight COVID if I'm exposed to it, which will help one person at a time get closer to the end of this pandemic so we can get back to life as normal without masks, and we'll be able to see friends and family like normal again. So just wanted to update everybody. Again, they've revamped the groups for the vaccines. There is 5 groups, and each group is just a group. There's no group 1A, 1B with groups within the group, none of that kind of stuff. They've made it a lot simpler. Right now, we're vaccinating group 1 and group 2. Group 1 is frontline healthcare workers and nursing home facility residents and workers. Group 2 is anybody 65 years and older. Next group will be essential workers. Group 4 will be adults at high risk for serious illness from COVID. And then group 5 is everybody else. One thing that I found when looking at the Gaston County website is that Gaston County has actually announced a virtual town hall meeting this coming Wednesday, January the 27th from 12 to 1 p.m. And they will show it live on the Gaston County government Facebook page. There will be physicians from Caramont Health. There will be members of gyms and Gaston County Public Health that'll all participate on the panel. You actually can submit questions that you would like to ask the panel ahead of time. I will post that link at the bottom of my Facebook post, but so you can submit any questions that you have to the panel. So that'll be available, and I think you'll be able to submit questions the day of, but if you want to submit beforehand, you can go and do that. I've kind of been hinting around to the fact of some information that I wanted to share that I'm super excited about. So I did this thing because I'm curious and I want to know if this vaccine has done anything good for me. And so after my first dose of vaccine, I do want to preface this with, I guess last year in February, before the pandemic was like announced or whatever, my daughter was super, super sick. I've never seen her as sick as she was in February. And typically if my kids are sick, I keep them at home, take care of them. Like, they have to be about to die or like hemorrhaging or bones sticking out of bodies or anything like that before I take them to the doctor or to the ER. With her, she was so sick and I started worrying about her so much that I ended up taking her to urgent care on 2 different occasions. Both times they tested her for flu. Both times she was negative. The first time they tested her also for strep. She was negative for that. The second time I took her when she was not better, and I was concerned that she was developing a secondary infection, which what I thought at the time was pneumonia from this mysterious viral illness she had that was making her so sick. I took her that second time to urgent care. They did a chest x-ray and she actually had pneumonia. So I'm kind of thinking she probably had COVID back then. And so last year, kind of after all this pandemic and everything happened, when I went for my wellness exam, I asked my provider to check my antibodies for COVID because I was right there with her every day. I actually took days off work, and I don't take days off from work unless somebody's dying or something significant is going on. And I actually took a couple of days off work to stay at home and take care of her because I was worried to leave her at home by herself. And so I had my antibodies checked to see if maybe I had antibodies to COVID, to see if that's what she had. Well, my antibodies were negative, and this was in August. And I can't remember, I really don't remember if I had Madison's antibodies tested. Either way, mine were negative in August. And she could have had COVID. I could have been exposed. I maybe could have had some asymptomatic COVID and maybe had some antibodies, but by August, maybe they were all gone. I don't know. Either way, in August, I was negative for the antibodies to COVID-19. So fast forward, I get my first dose of the Pfizer COVID vaccine December 18th. Fast forward 14 days later, I'm super curious and I come across some information and I end up checking my antibodies, and my antibodies were actually positive 14 days after my first dose. So I was super excited. The little line I saw that showed that I was positive for antibodies was faint, but it was there. And so I was like, I will wait. And after my second dose, I'll wait another 14 days, check it again, and I should see that that line is darker because I should have more antibodies after the second dose. Well, let me just show you this wonderful little thing here. So here is my antibody test. And if you will see that line right there, that little dark line by the IgG. Now, if I had active COVID infection, that IgM would be positive. So you see no line at the IgM. But at the IgG, there is a very dark, robust, lovely line, which says that my immune system responded to this vaccine exactly as it should. I am loving that line, and I just want to throw a party because, again, my body did exactly what it's supposed to. So now if I get exposed to COVID, my body knows how to fight against it. I can still get COVID. I could still get sick from COVID, but I should not, and I will not, get as sick from it as I possibly would if I didn't have the vaccine. Because if I did not get the vaccine, I would not have antibodies in my body to fight. I have soldiers in my body right now to fight against COVID if it attacks me. Granted, I'm in my 40s, 43 to be exact. I'm pretty healthy. I have thyroid issue. I have Hashimoto's, an autoimmune disease that attacks my thyroid. I'm on medication. It's very well controlled. As far as any other issues, I don't. So like if I get COVID, I'm likely not to get super sick and end up in the hospital on a ventilator, but there has been people my age that have been in the hospital with no underlying conditions or none that they're aware of. But I'm not willing to take that chance because I have 4 kids that need a mom, and I would like to live a little bit longer, and I don't want to suffer. And we are, there is question that we don't know the long-term effects of the vaccine, but we do know long-term effects from COVID. 1, being death. You can die from COVID. 2, long-term lung issues from COVID. There's been a lot of information put out there about scar tissue after COVID in your lungs. There's information out there showing different heart issues long after COVID. And so we do know, you can get clots with COVID. Clots can cause strokes. Strokes can cause you to be in bed the rest of your life. and somebody has to take care of you 24/7. So we are 100% sure and know that there are long-term consequences, and we know what those consequences, we know a lot of those consequences of COVID. The vaccine, we don't right now know long-term consequences. All we know is 2 months from the vaccine, there wasn't any significant issues. There was no significant safety signals or flags. So again, I weighed my benefits against my risks. And to me, getting the vaccine gave me a lot more benefit than risk. And so far, what the scientists have showed us and what the healthcare experts have showed us has shown true, at least with me. And that's why I'm sharing this journey, to show you, that you can take a vaccine and it's okay. And it's safe, 95% effective. And it did exactly what the scientists and the healthcare experts said it would do. And now I have antibodies. And for myself, I can live with a little less stress and worry about myself. Now, right now, we're not super sure. We think, but we're not super sure. I can still get COVID. I know I can still get COVID, but the thing we're not sure of is I can get it and still transmit it to people around me who maybe have not had the vaccine. So that's why, even after I've had the vaccine, I will still wear my mask, and I will still wash my hands, and I will still socially distance, and I will only go places that I have to protect others. It's not always about me, and it shouldn't always be about me. It's about others, and it's about loving others. And so that's why I choose to wear a mask. And that's why part of the reason why I chose to get the vaccine is to protect others. Because again, I don't want to get COVID and give it to my mom or give it to my patients, because my patients that I see are very high risk for getting super sick or die from COVID. And I would never want to not do something that can help prevent me from making somebody else sick. So whether that's my mom or somebody else's mom or somebody else's grandma or grandpa or somebody's dad who's had a kidney transplant, or somebody's sister-in-law or sister who is currently fighting leukemia. So we have many, many people that are out in public that we walk by every day that have many medical issues that we're not aware of. And that's why I wear my mask, to protect them, even though I don't know them. So super excited. And I would just like to take this moment to thank the scientists and thank the healthcare workers and the healthcare experts and Caramont Health for giving me access to the Pfizer COVID vaccine and giving me that opportunity to take the vaccine, to protect me and my family and my patients, but to also be an example to the community to show that I believe that this Pfizer vaccine is safe and it's effective. And I recommend that everybody, as a nurse practitioner, I recommend everybody to get this COVID vaccine. The only reason why I would say not to get this COVID vaccine is if you know that you're allergic to something in the vaccine. I encourage you, if you have any questions, let me know, or talk to your doctor. In Gaston County, again, if you are a Caramont Health patient, you can call your Caramont Health provider, whether that's your primary care or whether that's a specialty provider, and they can make an appointment for you to get your vaccine. If we've run out of appointments, be patient, because I really feel like the floodgates are going to open up as far as accessibility to vaccines, because I'm hearing that a lot of vaccine clinics are going to be opening up. And so even though it seems very slow right now, there will be more and more big opportunities to get the vaccine. And again, if I don't know the answers, I will find the answers and I'll get back to you. So if you have any questions, let me know. And again, I have many COVID antibodies in my body right now waiting if they need to fight against COVID because I took the COVID vaccine. And I saw that because I had an antibody test that showed that. So everybody have a great evening and a great weekend, and I will see you guys tomorrow. Bye.